Next to me is the medical director of the Environmental Health Center at Women's College Hospital. And because doctors across Ontario are sending the, quote, incurable chronic illnesses to her clinic, she was one of the first to observe the rise in numbers of patients whose symptoms can be traced back to electrical energy exposure, whether that be from dirty electricity, microwave radiation, cell phones, Wi-Fi, the smart meters, etc. Now, the phenomenon has been chronicled in the Globe and Mail, which featured Dr. Bray's work and her understanding of this emerging condition. Dr. Bray's work focuses on emerging conditions from environmental causes, such as pesticides, air pollution from suburban traffic, and she's been at the forefront of public education and standing out and speaking about this when the science is strong enough to say something. A lot of people say about you that you're very, very courageous, but I know that you don't think that. Because like so many of us in the room here, it's just what we do. I think what we have here is a group with probably the same personality type, is that we do it because we know it's the right thing to do. And her experience at the Environmental Health Clinic has earned Dr. Bray a unique understanding about how patients develop symptoms from wireless devices and about how the numbers are increasing across the province. And one of the things I'd like to start this discussion with is there a tool? Is there a questionnaire? Is there anything in loose form now that doctors could take away from them as a diagnostic tool?
That's a great question. So we had a student of epidemiology come in and spend about 3 months with us as we looked at our charts, only for the past 2 years, because we were trying to extract the parameters that we had gathered. And it reflected what was in the Austrian paper that you have in your folder. So that it reflected that kind of list. And Magda was saying that there's probably a better list. So I think we're kind of on the cusp of getting something that we can actually use. We would like to have a formal, just to launch this like the ship, right? A formal group to do like a case definition. So we use all the literature, and this student actually got all the literature, so we're doing everything by the book, and then we will put that all together in a formal list, and then we can submit that and put that on the website at the Ontario College of Family Physicians. We could submit it to the OMA. We could give it to the Canadian Pediatric Association. We can kind of just disseminate the questionnaire. So that's, again, just like this symposium, it's a way of increasing awareness that, hey, guess what? There is a problem out there. And you can actually use this to diagnose it. So, so we're trying to go by the book so we don't get slammed by a naysayer, and there are many out there. So that hopefully in the next 6 months or less, I think we'll be able to do that, actually. It's not very hard at all. No. So yeah, so we just have to probably do some emailing and find out how many people we can put in on that panel. And so we'll have to do that. And then we'll just invite people, and maybe we can even just thrash it out in an afternoon, and then we're done. So I think that's good enough. I think that the research has been done. The student did a good work. So I think we're very close to having that out. We just need a little bit of organization, and then we're done.
Would it help, you can keep that because as the questions come up, you can pass the microphone around, with the talking stick. Would it help if doctors gave you input from their clinics, if anybody was noticing anything, if there was any easy data to get by spending an evening with their files that they could send to you?
Oh, yeah. I just love it when doctors call me because it helps me get a feel for what's out there. And so how could that happen? Well, how could we make it more easy for doctors to pick up the phone and call us at the Environmental Health Clinic with, maybe there's something going on. Again, I think that we have to start with awareness. So again, the Ontario College of Family Physicians, I think they would be receptive to putting something up, perhaps. Or the Medical Post, the lady I was talking to, if she could sort of make the physicians aware that this is a problem, and if you think you have a patient like this, you can, you could direct them to the Austrian questionnaire for now until we have something more formal. And that actually we should post up on the OCFP website. And so, yes, that would be great to have doctors be able to pick up the phone and call and say something. Or we could even have a helpline or hotline.
If you wouldn't mind, to the microphone, this just helps people at the back to hear. Is it possible to have the air conditioning turned off for the rest of the session? If there's anybody at the back, and let them know in the kitchen. It's off, apparently. It's off. It's now off. Dr. Davis is cold. Sorry to interrupt, but thank you. We filled the time.
No, that's fine. You've already done this, but the College of Family Physicians has an annual scientific assembly, which is a good place to reach a lot of physicians. Primary Care Today reaches thousands of physicians several times a year, all across the country. I don't know if you've ever presented at any of those meetings or if you've thought of it.
That's a great idea. We have not, but that's a great idea. So is anyone taking notes? Somebody take notes.
Wendy, if you don't mind, the thing that was, could you take a couple of notes on this? Just to help. It was just mentioned that the College of Family Physicians has an annual symposium, which we could try to submit at the College of Family Physicians. And what was the other one?
That's the annual scientific assembly, which takes place in November. So that's all set for this year.
So the annual scientific assembly.
That's the College of Family Physicians meeting. Huge meeting.
Yeah.
And the other is Primary Care Today.
Yep.
Primary Care Today.
Which reaches thousands of physicians.
So these are the Ontario and Canadian assemblies of like-minded doctors that we could try to influence.
That would be a great idea. And also Family Medicine Forum, FMF. So that's, it's a bit late now, but starting in January, they'll be calling in for more submissions.
Deborah, did you have a comment on that?
Well, there's also the Canadian Association of Physicians for the Environment that would be, I think, very eager to put out a case definition. And frankly, you guys might do your definition and brainstorming in an afternoon, but I think in order to get this owned by more groups, what you want to do is put it out as a draft and invite other groups to comment, and then actually have a brainstorming online session where you review it. As some of you know, I used to work at the National Academy of Sciences, and this seems to me very much like an academy project where, as Tony knows very well, you have a draft, and then you have another draft, and then you have another draft. But by the time you're finished, people really own it. And they've all had a chance to weigh in on it, and they don't say, well, I didn't agree with the tetramethyl chicken fat being in there or something. And you get a chance to really vet it. And I think that this should be a community-generated thing, and you're going to want to run it by some of the skeptics as well, so that you get the opportunity for more input.
That's a very good point. So we float the ideas through other medical academies and other medical groups.
It's also important. That's for electromagnetic hypersensitivity or electrical hypersensitivity. But the other issues, the fetal issue, is a huge one. And that one, we should have a separate group panel to engage the other organizations, the Society for Obstetrics and Gynecology, and the Canadian Pediatric Association, and Mother Risk, and nurse practitioners, and all the guys out there sort of doing prenatal work. And then that would be a separate thing, but very, very important thing, because electrical hypersensitivity is one thing, but we've got millions of kids being born. We got to get on the wagon like ASAP. So that, for me, is first and foremost, but we need volunteers, so if anybody's interested, let me know.
Something else that's very important, I think, is we have to get this information into medical schools. Get it right in before, people have gone through their naturopathic or MD training or chiropractic training. It really has to go into schools that are training healthcare professionals.
I think for that to get there, we need people at your level to be doing that. Yeah, to get invites.
One other thing that we need desperately, I have a lot of people who contact me, either phone me or send me emails, to the point where I can't physically respond to the questions that are asked. But one of the common questions is, I think I'm electrically hypersensitive, where can I go? And I know Women's College Hospital has a very long wait period. These people just want to go to a doctor who understands what this is, who understands the concept of electrosmog and electrosensitivity, who can do some preliminary testing, who can make some preliminary recommendations. And one of the things that would certainly help me, and I think the general public is a directory of healthcare practitioners who are familiar with the issue to some degree and are willing to take patients on to try to assess them. And I think whether it's the Women's College Hospital or whether it's C4ST or whether it's some other independent website that sets something like this up, because very often what I will ask them, the first question I ask is, where do you live? Because if you live in British Columbia, or if you live in Florida, or if you live in, Timbuktu, it's going to be a different physician that you go to. And some of these people are so desperate, they're willing to travel to another country if they have to.
That's a bit tricky. I know Joseph is probably thinking the same thing I'm thinking. So there's always a fear in the medical profession that somebody's going to call you a quack. And then they're going to, bring in the Gestapo and they're going to take your license away and lock you up. So that's why it's really important that we do this from a public health perspective first. So in other words, have somebody or some organization, this is why meeting with Ray Copes, I was totally excited beyond belief, who's the head of the environmental health arm of Public Health Ontario, because they need to have a response line. It's the medical officers of health in the communities that need to understand this is a public health issue. And they need to be able to take those phone calls, and they need to be able to respond to those phone calls, and they need to be able to triage whatever comes into A, B, C, or D, you see? And that way, and that's why trying to get this, that's why it's so important for us to get our literature sorted out and some position papers brought forth so that we have buy-in from, Public Health Ontario. Howard Hugh is also very interested. That's great. And I think fundamentally these people, they know what's going on. I think people have to be so completely out to lunch to not understand that there is a problem here. So I think what it is, it's all political. And people are trying to not say too much because they're afraid they might lose their job, or they're afraid that one of these big IT companies is going to go in and sue them or something like that. And there is a possibility, because when the tobacco business was out there, people were getting, wiped out, smudged up. So it's very important that we do this in such a way that everybody's covered, but we're sort of moving forward in a sort of militant fashion with a purpose, a common purpose. And so public health, it's a public health problem. That's the way I see it.
It's very important to define that, because you're right. And there are many doctors who work outside of the realm of what is considered the standard of practice, and instead look at a patient-centered approach, which is not only not recommended, but not allowed. Please. Repositioning for the camera, so that when you stand and the microphone, you're not blocking me. I'm joking. It's for Rena. Thank you. Please.
They can't call us quacks if you are able to help us outline where we appear in the ICD-10, and I think we really need that. Whether it's EMHS or it's fetal or many, many other symptoms, it has to appear in all of neurology. Every single one of those vocabularies has to appear in oncology, in all the tissues that are affected in ionizing radiation. So that's number one, ICD-10.
Exactly. Good job.
Number two, DMS3. We have to be in DMS3. It's a poison. It's in the environment. We have to be able to see it there. And it's actually hard to see cocaine there. And we can measure that. So we have to get that going. Clinical guidelines. We need a clinical guideline. And then it can be a terrible clinical guideline. It can't even be any good. That's fine, because CMAJ will put it up on their website, and then someone will have to react to it and do it better. Cochrane needs to get with it and do something about that. Jeremy Grimshaw is a great advocate and partner if he gets something to work with. So the basic
we'll have to talk.
And then we need the Healthy Heart Kit, which is a guideline for the family physician. But a Healthy Heart Kit takes in, it's just an example, of a guideline that takes in multiple chronic diseases and gives multiple causality, and this resembles that. And one more thing,
you need to go slower, because people are trying to write these down, and you've got great ideas.
And then the last one.
All right, we're going to have you repeat
just one
it.
More.
Right.
Okay, there's one more, and that's occupational health. And I agree with public health, and there's data there right now. So ICD-10, DSM.
ICD-10.
DSM-3,
DSM-3,
clinical guideline, Cochrane profile, make them do it.
Cochrane profile,
Healthy Heart Kit example of a multiplicity of causality with a multiplicity
toolkit
of systems.
Diagnostic toolkit.
And therapeutic.
Therapeutic
advice.
toolkit.
It's a guideline to the doctor and the patient for multiple, stroke, heart attack, and whether you've got diabetes or you're fat or you're hypertensive, all those things feed into those outcomes, and that's similar to the situation we have in here. And then the last one is occupational health. All those beautiful young men, those guys that we like to follow around in the supermarket, they're up on top of these lines, we're murdering them and electrocuting them, and there's data, and we can use that.
All right, so Dr. McLaren, excuse me.
You're following men in the supermarket? I'm sorry.
No. No, she's talking about the guys who are on the towers who are. All right, well, there are men dying on. Yeah, okay. Dr. McLaren, you have just come back to your country from several years in Oxford, where you were managing hospitals and healthcare systems, and you know an awful lot about this system. I'm going to put you on the spot and say I hope that you will be able to work with this group here, because your ideas are incredibly important and exactly really what's needed now. Because we need somebody who, if I may say, has your medical chops, who understands how the system works, who understands how the data are gathered and what's needed in that system. So I hope you will sign up, frankly, and I'd like to volunteer you to chair a committee on exactly this, and
there's a man up here who would probably beg to differ that you're too old.
I'm not sure about what too old means.
Tony?
His wife told me you're not too old to be a captain on a boat when you're a certain age. So I'm not sure. All right,
Joseph.
I just will make some comments on some of this issue, and this is, first of all, thank you very much, Rodney, that you organized this conference.
I didn't organize it, Frank did. Yep. Yeah. I showed up today.
We did it together then, okay. Anyway, and it's so important. And as I was told in environmental medicine that I was right now practicing, for very many years, and now not as the doctor, that this. And we have been teaching people about the total load. And the total load sometimes was illustrated by the camel, which is carrying a lot of different load. And there was the last straw, which broke the camel's back. Now I think that, and we saw under this umbrella so many different factors in the environment which have been involved, into this total load. The electromagnetic sickness and sensitivities, I guess, come kind of later into the awareness, and I did see it in the practice maybe 15, maybe 20 years ago, but there was very, very sporadic cases. Now, the situation is different. We see it almost in every single one of the patients which come to the hospital, clinic, private facilities. But I would say that this electromagnetic sensitivity and the electromagnetic radiation problem is probably the one of the factor which does not break the camel's back, but will break the humanity and humans. I just wonder what else could come after it. But this is serious problem. But what I wanted to say, that in order to help the patient, okay, of course prevention is number one. I mean, we have to keep it away. I was just mentioning to Frank that I am possibly in this room the only person who is computer illiterate or just computer stupid, okay, and I regret it. I still have a good wife who helps me, with the computers to use this and so on, but maybe I am not that much exposed, that let's say I was exposed to chemicals as the farmer's boy, very many years in Poland, and so on, okay? But there are the helps for those people, okay? Protection, prevention, okay, don't touch, keep it away, it's all fine. But those people are already damaged on so many different levels. And the approach from the environmental medicine, where you have to clean up their home, okay, not only from EMF, but also from molds, okay? And we know that, frankly speaking, if you have molds at your home, you're going to, or if you have EMF at home, you're going to have much more molds than the homes which obviously you have to have the water damage, so on, okay? There is so many factors that you have to look when you're looking at the patients. And you have to look from those total load point of view. And you have to go one by one, each and individual ones, etc. And I know, for example, that if the person is still eating garbage, meaning dead food, okay, which is all the packaged food that neither mouse or rats will not take, okay, if you expose them to it in the garage, they will not go through it, they will not chew any of the box, they will not get to it because there is nothing to get to from it, okay, and the rats know it. And there is another other issues, and I know that when you going to suddenly, see the biological exposure to molds, and you're seeing that those people with environmental sensitivities and the electromagnetic sensitivity, they suddenly, they are much more easier infected, okay, and you have different disease, and particularly, some of them which is also spreading in the world like the plague, which is the Lyme disease, from which doctors are losing licenses, etc. And when you approach and you deload the system, okay, by the knowledgeable approach, which I learned from the environmental medicine, then, suddenly the electromagnetic sensitivity is starting to be somehow much more less
tolerated.
That's very, very interesting, Jill. So I just wanted to turn this over to Rena. Do you see this at your clinic when they come in with this stuff? Do you look at these other things? I mean, Joseph has a decades-long career in environmental medicine and ran one of the most important environmental medicine clinics in Ontario throughout the 70s, 80s, and 90s. Do you see this kind of thing, and do your doctors take that approach, that multidisciplinary approach toward it?
Absolutely. So what we're doing at the Environmental Health Clinic is we are putting electrohypersensitivity into the category of environmental sensitivities. So that includes chemical, et cetera. And definitely if a person's total load is up, they're more vulnerable to the electromagnetic fields, definitely. So we try to, as Joseph was saying, unload them, try to get the mold out, reduce the amount of garbage they eat, eliminate that. Decrease the amount of chemicals they're having at home and at work, decrease stress, because stress is another toxin in people's lives. And so we go through the whole gambit of things that can cause problems in the body. And yes, indeed, people are able to tolerate the EMFs better. And but that doesn't mean that they can go and turn on all the Wi-Fi at home and just keep going, because it's just going to get them into, I think we're all going down that same road, even if we're not hypersensitive. I think eventually, if you're not right now, you will be later if you keep on exposing yourself to the doses that we have out there, depending on where you work and where you live. So the best thing to do is the avoidance and the reduction. And yes, we do we have a very holistic approach. We look at absolutely every single angle of that person's health, and we try to work on every single level of that person's health to help them bounce back.
Deborah has a comment on that. Thank you so much, Joseph, for bringing that up.
There's a fellow named Virchow, who, in fact, you must know. Virchow, who was one of the founders of environmental medicine. And I think we're coming back full circle to where that 19th century ideas were. that really not, okay, food is medicine. We all know that. That's from Hippocrates, right? But in addition, the environment really is key to health, meaning the total ambient environment. And that medicine has, in its modern form, basically found pills for ills and focused on the development of drugs to treat illness and lost its compass as prevention. So why I'm excited that Women's College is reconstituting itself as a source for prevention. What it means is that we're going to have to go back to community medicine. The idea is that it's the community, it's the workplace, it's the environment broadly, everything exogenous to the human body, and that as much meditation as someone can do. I'm thinking about my old experience at Hopkins with lead. And I think, Tony, you must have had this experience as well. With lead-poisoned kids, we'd go out in the community, we'd identify a child who was lead poisoned, we'd bring them into the hospital, we'd chelate them, because these were really sick kids, and then we'd send them home. And guess what? In 6 months, they'd come back. Until finally it was understood that this wasn't really going to work, and that we had to come up with a better solution. So we banned lead paint. And that, by the way, took far longer than it should have. Far longer than it should have to ban lead paint. We got lead out of gasoline. That was in the 1970s. That was the big debate. Could something in the air actually affect a child's blood lead? Well, you betcha. And Mary Amder showed that in 1948. And at Harvard lost her job for having shown that there was lead in the air when you combusted it in gasoline, because the Ethel Corporation went after her. I'm getting rid of the feedback here. I don't want to. But the point is, we are now at that stage for environmental medicine, where we have to understand that it's not just helping to people to be calm and less stressed. We've got to start to address the environment and come back to environmental health, which is a big issue, not a little one.
And I just want to circle back to something that Rena touched on. You said quite provocatively, if you're not sensitive, you may become sensitive. And for the doctors in the room who maybe haven't treated this yet, is there, like, my wife is very sensitive, I'm not terribly sensitive. Does it work like that, or can you develop a sensitivity over time?
For sure, you can. It depends. You see, we can't go through life without having some sort of impacts affecting us somewhere along the line, whether it be an illness or maybe an accident, God forbid, or stress or what have you. So a person could be genetically very robust and be able to handle a lot, and they might have no problem till their dying day. But if we keep pounding people with so much stuff out there in the environment now, it's overload, total overload. Things happen prematurely, and you have no control, right? You're it, and you can't clone yourself and see how you would have done if you'd lived elsewhere. So I think everyone's lives will improve once we start reducing these exposures.
We have a few more questions. Jody, do you have another comment?
I have last comment, and I'm disappearing.
Don't disappear, Jody.
I know that this is a huge problem, and it is a social problem, this is a public problem. But I think we have to also think that this is also the legal problem. And I will tell you why this is the legal problem. Because it is unseen and unforgettable that the doctors who are working in this field, okay, losing license over that matters. And we have to protect the doctors. Otherwise, there will be no physicians joining this organization, trying to do anything, because everybody is scared, very much so scared. And I know it very well, because my lawyer once told me that to lose the license, it is like the death penalty for the doctors. So the doctors have to be protected. I don't want to put the names, neither call the names or anything like this. You know where is the doctor police. And I hope that we have to give the protection for doctors, because otherwise there will be nobody who would like to practice this kind of the medicine. Thank you.
Thanks, Joseph. Now, I'm going to, if anybody's familiar with Dr. Kropp's legal battles, you'll know that for the crime of finding the cause of disease, eliminating it, and curing the patient, he spent a lot of time under investigation. And his comparisons of the College of Physicians and Surgeons to communist Poland are bang on accurate as far as I've studied. Please.
Nabil Bendago, thank you so much for. I'm so happy actually I'm here, even though I'm not a doctor, and I'm very honored to be lectured by all the guest speakers here. I gathered all the information I've learned today, and I wanted to leave all the questions to the end. And basically, what I wanted to look at is we live in a world nowadays. People walk into cafes and restaurants, don't ask if they have Wi-Fi or not. What is the password for the Wi-Fi? Assuming that there's a Wi-Fi. We also live in a world where you go to schools, they're improving the Wi-Fi range to bigger and higher and faster. We also live in a world where moms track their pregnancy with apps on their phones 24/7. We live in a world where also kids with special needs use iPads, iPhones to communicate with the family. We also live in a world where doctors are actually connected to their phones most of the time to be able to know what's going on in the hospital. And then you have Mark Zuckerberg, which is the Facebook CEO, coming saying, we need to connect. Their mission now, there's something called internet.org. Their mission is going to be connecting everyone in the world in the next few years by wireless. And they asked him if he's going to work with Microsoft and Google, and he said, shortly we're going to be engaged in this. And then you have Google, who is going to be doing 180 satellite for the next few years. So it seems like we're getting connected. They're going to make sure this is going to happen. And then you, great doctors, say, distance is your friend. And Dr. Anthony talks about 10 years to actually see increase of risk of getting brain cancer. And we also have Dr. Frank saying that we can't measure the use of usage for people using internet and wireless. Don't you think it's going to be too late taking all this time from now? I feel it's like cancer. You can't control it in the next few years. It's going to be, we could manage to have the no smoking sign, years ago. I don't think we're going to see this happen because we couldn't even do the sign now for no Wi-Fi zone. And by that time, it's going to be too late to actually say, hey, even though we're going to be all connected, we're going to put a sign that says we can't connect each other. So we live in a world where creativity is a human right. So I would like to see what your feedback is on this.
Okay, I totally disagree with you that being totally connected is the way we're going, and everything you've said I agree with. However, if you look at any of the other pollutants that we've dealt with, lead, for example, it was in gasoline, it was absolutely everywhere, and we were able to push that back. If you look at lead levels now, emission of lead levels, it goes down exponentially. We had asbestos absolutely everywhere. It was put in cardboard boxes for your cereal. They were trying to get rid of this stuff, and they were selling it. It was in clothing, it was in insulation, it was absolutely everywhere. You couldn't go anywhere where there wasn't asbestos, from brake linings and that sort of thing. And we got rid of it. So I just don't know what the time frame is going to be, and I'm hoping it's within my lifetime, certainly. But this is going to turn around, because if everyone is getting sick, if everyone, as soon as a Wi-Fi goes in or a smart meter goes in or a cell tower gets put next door, and you are so sick you cannot work, your kids are so sick that they can't go to school, our society is going to deconstruct. And we're going to change it before than we have every single time. So I'm incredibly optimistic that we will find the solution. I just don't know when we're going to find it. And the sooner we find it, the less people who will suffer. So doing this quickly is very important, but it will get done. I'm totally convinced of that.
Okay. I agree with Magda. I think that's why it's so important not just to look at the doctor. Actually, don't look at the doctors for the answer. We're going to do our best to do our job. But look at yourselves, look at your family, look at your friends, look at your community, look at your schools, look at your whatever, look everywhere and do something. Don't just wish. Say something.
Thank you. The men in these photos would have smoked in this room. Outside in the gardens, pesticides were sprayed as people drove by without seatbelts on in my lifetime.
So anyway, you have the power, empower others. There's lots of websites you can refer to on a wired computer. There's lots of stuff you can do in your home and in your community. Like, just do it. Don't just sit around. Just do it. You don't have to wait for all this fancy schmancy stuff.
You should coin that, just do it. That can catch on.
Just do it.
My name is Mark Derry. I'm a developmental pediatrician. My name is Mark Derry. I'm a developmental pediatrician. I'm going to bring the discussion to a little bit more focused because listening to the presentations today has made me think of a very vulnerable group, and that is premature infants. Not only are they their stage of very immature or early brain development, much more susceptible, but they're also exposed to a lot of radiation from all the technology around them. Do you know of any studies that have started to look at electromagnetic radiation in that group of children?
I don't.
I've talked to some medical doctors who are dealing with premature babies, and one of the things they tell me is that the heart rate is irregular in premature babies when they're put into incubators, and it's not clear whether that's because they're premature or whether it's because of their electromagnetic environment that they're in. But certainly this is something that I think does require research because they're so incredibly vulnerable.
And it could be protected if you put a shield around them.
That's right.
All these are easy fixes, sorry, Deborah, but a lot of this is an easy fix. You can walk into whatever environment you are at, like the NICU, etc., and you say, wow, this is wonderful technology wherever you are. But you know what? We can do this in a better way because, radio waves, microwaves, that's not very good for your health. And you could look it up if you want to. But really, let's just be sensible about this because we really don't know what we're going to be doing to people or little babies or what have you. Why don't we try it like this? And it's cheap. It's not expensive. It's like put a wire in, etc. And people, if you don't say, if you don't insult them, but you give them an alternative that's easy, and you pat them on the back for their great technology and everything, and if they use it properly, everybody wins.
And there's issues other than health as well. There's a privacy issue. It's very easy to get into wireless messages, picking them up. If someone has a baby monitor, if you tune your monitor the same channel, you can hear what's happening in a household. So there's other issues as well in schools. There's problems with sexting, is that what it's called? There's all sorts of issues. And in some cases, if we can't sell it on health, we can certainly sell it on some of these other issues that people really, want to protect their privacy. So there are multiple avenues to deal with this. And one of the best ways to communicate is through fiber optics. It's the fastest. It's just phenomenal. A lot of communities have fiber optic networks, and they're being built out because that is the future of a lot of this technology. And that means that if you're in a sedentary environment, you use fiber optics. If you're mobile, that's the only time you need your wireless. And so that would cut down on wireless enormously.
But to go back to your question about pediatric development and premature infants, there is a literature on the effects of blue light, 400 nanometers, on hyperbilirubinemia, as I'm sure you know, and it's clearly biologically has an effect to increase the formulation of vitamin D, dihydroxyvitamin D. That's been used for, I think, almost 40 years now as a treatment for hyperbilirubinemia. So blue light, we know, and have known for 40 years, has biological effects. No question about it. Blue light's used in NICU, is used for babies that have jaundice, right? It would not be difficult to identify opportunities in the healthcare environment. Are any of you involved in a group called Healthcare Without Harm? All right. I think we need a committee, Dorothy, you can run it, to get healthcare without harm, to include in their definition of a green hospital, reducing wireless to the lowest extent feasible, the ALARA principle, because hospitals have become a hotbed of Wi-Fi with very little thought about what it's doing, not only to the health of the patients, but when at the University of Pittsburgh, where I was chair of their green committee, we would have young techs who were like doing the cardiac monitors on patients, they would have on their pregnant abdomen 2 or 3 wireless devices so that they could get pinged when their patient was finished with the whatever. And let me just say that when I raised the issue of whether this was a good thing, I got a lot of pushback. But I think now is the time to raise these issues for the health of the health professionals. Okay? These are the people who are in this soup of radio frequency radiation. For the health of the premature babies, which everyone claims to want to protect infants at least when they're first born. And we could put together, I think this is another topic, a separate topic has to do with the use of Wi-Fi in healthcare, the use of Wi-Fi for insulin pumps, for cardiac monitors, for babies, and believe it or not, some NICUs have actually taken to putting iPads inside the incubator so that the mother can talk to the baby when she's just had a C-section. And there's even an app that I think I mentioned to some of you where the mother puts the phone on her chest and the app mimics her rate of respiration, and then the mattress, which is wireless, breathes like the mother's breathing pattern. So these are things where there's a technological imperative that says because we can do something, we should. I'm going to go on record right now and tell you that the Apple phone is going to fail. And it's going to fail because it's a perfect example of a technology developed by a bunch of 20-somethings who don't have old eyes like many of us here do. And who's going to be able to read these damn things? You know, have to put, right? No. No. But you understand, you need another task that should come out of this meeting is to get a group that will work on reducing wireless in the healthcare system. All right?
I just want to add to what Deborah was saying, that there's another area where we need to remove Wi-Fi, and that's home monitoring and home security. And it's perfectly possible to persuade a firm that you want to put in home security to put it in wired. They're annoyed, but they will do it. I've done it twice. So you don't agree? No, but it's internal. It's not external. Yeah, but a burglar. Well, if a burglar's in a home, he's already in. So that means the device hasn't worked. But you've got the same thing happening with Rogers trying to persuade people to buy things that will monitor their homes all the time, and that's again wireless. So we've got to get at these various firms.
Thanks, Anthony. Anne-Marie?
I had a kind of a question. It's about when members of the public have a concern and they think there's a cell phone tower. One just went up right beside the Student Health Services in the University of Waterloo, and it's very close to all the student residences. Giant tower, no label, no one knows what it is. I know there's now C4ST. Maybe there's some way that people can just kind of call in and say, I want to know what this is, or perhaps should we direct them to public health? And if public health departments started to get calls, then they would have to answer to it. But my experience is that public health, like MOHs, are very conservative people. I'm so excited
more so they're taking specific direction from the Chief Medical Officer of Health of Ontario that none of it's true. So they're abiding by the party line.
That is absolutely right. Like one in my community turned back on us when I was talking about pesticides years ago. So it is difficult, but if you have an in with some public health, I'm thrilled.
Okay, I get a lot of those complaints. You know, I was fine, and then they put up the cell phone tower next to me. Anyway, I know that through C4ST and various people that I've spoken to, they do help each other in terms of who to contact and how, because they're all trying to get on it. I think there has been some success. Well, the smart meters was Ontario Hydro, and there are people to call for that. But for the cell phone towers, I think it has to be a community effort. So if you can get a petition or enough people signing in saying that they're concerned about this particular thing and that they're not too comfortable. And by the way, it has to be more than 500 meters away from any living thing to not have an effect and have potential cancer. So if it's closer than 500 meters, you've got a case in point, right, Magda?
Hi, my name is Christine Darbison, and I'm an activist in Covermere. I just wanted to mention a couple of different things. The first thing was that everyone's talking about sensitivity, hypersensitivity to EMFs. It's actually not true. If you put a human being in front of a smart meter a foot away, they all have changes in their blood. Some people feel it, and other people don't feel it. But it does change everyone's blood.
Yeah, sure. This is partly what Dr. Kropp was talking about, the straw that broke the back. This is a symptomatic recognition as opposed to a biological recognition.
That's right. It's not 2 or 3%. It's all of us. Another thing is that Safety Code 6 has never been intended to protect the general public. It is only for federal buildings and the employees and visitors that are there. It has nothing to do with maximums of devices. It has nothing to do with the manufacturing of devices or, like what Frank said, accumulative effects.
Yeah, it's a guideline it's an outdated guideline that's been de facto adopted by those who don't know what else to do, what it is.
That's correct. And the tower companies, Rogers, Bell, whoever, do not have to use the guidelines. There are no guidelines.
Yeah,
there
well
is no
aware of it. They
protection.
registered 34% higher than the guideline in my kid's school, and the resultant recommendation was we can allow it 50,000 times higher. So the irony is not lost on
So I just want you to know that we are counting on the doctors here to take a stand, to protect us, to go about this in a different way. And I really, really appreciate all of your work and dedication to this cause. And I'm just so grateful for all of you here.
Thank you so much.
Hi, my name is Marcel Wolf, and I'm a holistic bioeducator. So it's air, water, food, movement, and of course frequency, which trumps everything. It's primary to all life. What's safe? Dr. Neil Cherry devoted his entire life, an epidemiologist. And his conclusion was, 0 is safe. And that's, we have evolved and adapted to, and now we're dependent upon natural frequencies. People like the inventor of electricity told us over 100 years ago, exposure to fields that he created would be the most harmful thing to all living things. So there are people suffering as we speak, and so we need to get to them sooner instead of later. And I suggest that we try and work as hard as we can to educate the masses at the grassroots level. My example is Coca-Cola and water. The Coca-Cola company never wanted to...
So I just wanted to... Yeah. We're aware of that, the Coca-Cola, the whole thing. Do you have a question, perhaps, for the panel?
Okay. My point is that it wasn't the company, it wasn't the government that stepped in and said, we've done enough harm, we've made enough profit. It was actually an increased awareness at the consumer level, and they forced corporations and governments to do. So what I'm saying is that 5% is critical mass. It's doable. The best thing that we can all do is to educate people at the consuming level as soon as possible.
Thanks so much. Yeah, please.
Okay, LAR, Swiss Bionics Solutions, Medical Devices. I think it's a question or a recommendation, and it leads back to what you said. You know I was going to get at you. How can we involve more younger people and younger doctors, because we seem to be a particular generation, right, who are not as adaptable to new technologies, are more reluctant to use them, versus what your generation is like, that readily absorbs them, and then we get statements from you, don't be offended, don't you guys think it's too late to do something? So I think, we should also involve younger people into our campaign, and I love to help with that. Okay?
I think the reproductive issues that Dr. Davis and Dr. Taylor brought out today are going to be the way. And I also should point out that it has been a very long day. We are approaching 3:15, so there's 2 more people on the floor, and then we'll say thank you very much. Please.
Hi, my name is Susan Aaron. I'm a sometime lecture at the University of Toronto, and I teach those young people. We look at the internet, but we look at it from a very environmental health perspective. What is our communication? What is that first? Then why and what do we do with our devices? And to work at that, I went through the Medical Institute at the University of Toronto, and I looked at what is creativity. It's embodied. And so then we add on these devices. So we are people, we're physical first. So one of my questions, though, is when I was doing my studies in environmental health, and I spoke to Dr. Havis, and she may not remember, but we looked at the levels required, this is public health, allowed for in a city. And in running into other researchers, some from Europe, for example, the levels, international levels, are much lower than what Toronto has. So that's one question. And the second one, I think, would have gone to Rita Bray, so I may ask her later, is that I also have seen, and I've used, well, I haven't really used, but I've seen that there's research out from the American Medical Association about mental health issues. And I think that goes directly to the whole body-mind, that if you're creating a mental issue, we looked at ADHD, I don't even know if you have to go in an interdisciplinary sense, which we need terribly, do you have to even go to levels, rats, et cetera, you know immediately that you're harming someone on that level. Can you not stop there, look at that, and go, why should we even use this if it's doing harm immediately? So those are my two questions.
On the first question, Dr. Miller has himself presented to the City of Toronto about the total levels. Perhaps he would speak to that, to the international differences in what is allowed or what is recommended in an urban environment.
I can't really speak to international differences, but just let me make a comment on Toronto. I did present, and then I went to see the Medical Officer of Health after that, and I spent some time with him and his colleagues. And I think there is an appreciation of the issues, but there is also a big political issue here, that a lot of the councillors are not that convinced. And I had a run-in with a councillor who just refused to accept that EMF could possibly damage cells because it wasn't ionising. And, you know, he tried to teach me physics, and a lot of people have tried to teach me physics, and it hasn't worked very well. But he was right. He was completely wrong. And the trouble is there are these ignoramuses, and this is where C4ST and everybody here has a great deal to contribute to educate people and make sure they do understand what's going on.
I think Magda has some more points on that, but what Tony is saying is that the differences are largely social movements. They're largely how much you can influence the politicians of the day.
But what I found is that the technicians with the city were listening and watching the levels. So it's interesting that the councillors aren't. They haven't seen beyond the excitement of the use of the technology. So
you asked about the Toronto guidelines versus international guidelines. The international guidelines for, let's say, Wi-Fi 2.4 gigahertz is 1,000 microwatts per meter squared. Health Canada's guidelines identical. In 1999, the medical officer of health for Toronto was Dr. Sheila Bazer, and she held a public meeting where Dr. Henry Lai came. He was one of the people mentioned today. He's been working in this field for a long time. We had a 4-panel member discussion about the number of cell phone antennas that were being erected in Toronto. By the way, Toronto has the highest density of cell phone antennas anywhere in Canada. It's absolutely astronomical. And if you go to any websites where they show you where these towers are, you can't see land because there's so many antennas on individual towers. At that time, she was very concerned as the medical officer of health, and their department, their health department, decided that 1,000 was too high, and they thought it should be down to 10. So the guideline for Toronto is 10. They tried to change that guideline just last year, right? Not this year? This year? Okay, they tried to change that guideline this year, trying to get it back up, and fortunately, people like Dr. Miller went and convinced them not to do that. Someone mentioned earlier that Health Canada's guideline is a guideline. It's not a standard. Industry can violate it at will. The Toronto guideline is not a standard. Industry can violate it at will. It's totally toothless. It's just an important message to Health Canada saying the guidelines are way too high.
Thank you. Deborah McCutcheon, one of the most important activists on this question in Canada today. Deborah, whenever there's somebody that we say, this guy's too high up, he says we're all wrong. Deborah says, well, I just had a meeting with him last Thursday and I think I'm turning him around. So she is working so quietly and behind the scenes and so effectively for all of us that I give you the last question of the day.
Oh gosh, not to put me on the spot or anything.
Better be good.
We've talked a lot about how do we get critical mass in understanding of this issue. And one of the things that occurs to me at a deep level is that what was presented today is that it's a 2A carcinogen rather than a 2B, if we take the science that's available today. And my question has two parts. Number one is, how do we get IARC to reconvene, to give the 2A that it deserves, this carcinogen? And number two, please set me straight if I'm wrong, that this in itself will have an impact. Because what we saw when it was a 2B carcinogen is that it came out, it was lots of press and coverage, and then the industry stepped in, the World Health Organization main website diminished the credibility of IARC. And therefore it led to confusion and dismissal. So can we get 2A, and can we make it stick and make it important, and is it the case that it will be given more credibility?
Well, there is unfortunately a program that IARC has in terms of when they modify things. And at the moment, this is not on the radar of IARC. I'll be there in November on another topic, and I'm going to re-raise the issue with the director and the head of the monograph program, but I don't think they're very sympathetic. I'm actually more encouraged by the possibility that groups in Europe, together with people in North America and CRST, can influence WHO itself, not IARC. I think WHO had a big issue when Mike Repicoli was still there. He's not there. And there are people around who recognize there is an issue. So I don't think IARC's reputation has been diminished. Those of us who've been writing on this issue, and you've got in your package the paper that Deborah wrote and I signed on to, and others, we're going to continue to push this, and I think it will eventually have some impact.
Thanks so much.
Several members of the monograph, including Darius Lashinsky, Leonard Hardell, I think Segal, have now said they believe it is a probable human carcinogen, said it publicly, and it will be, but it's a process. And I think the question really is for you, what are you going to do in the meantime? And I think that we need to organize on specific targets and focus on those things that can be done. And you have some fruit on the ground right now. You have some things that can be done. I think the issue of whether or not there shouldn't be already Wi-Fi free zones, I mean, why shouldn't that be something that is called for as a matter of right?
Just first of all, Magda, they do still put asbestos in the brakes in the cars and so on. Okay. But what I wanted to say was I do a lot of public speaking. I do a lot of screenings, lectures, and so on. I often will ask a group, how many people have contacted your member of parliament? Rarely a hand will go up. How many have contacted your MPP, your provincial member? Rarely a hand will go up. How many of you have contacted your city councillor? And I know who your city councillor was, who did what he did. But if you ask that question and you find out that people need to be engaged and they haven't thought about that, their representatives have offices right in their ridings. They can go and they can talk to them. So just to bring the message back of how do we bring activity to come from the base to support the kind of work that we want to do. And it's very successful because we did it with the pesticide bylaw campaign. We were 18 organizations in Toronto. We got the Toronto bylaw, then we got the provincial bylaw, and now CAPE, the Canadian Association of Physicians for the Environment, is working with the Canadian Cancer Society right across the country. So it can be done, as you said. There are lots of good examples, young people, older people, but be in touch with your elected representatives because you elect them and they sit there for 4 years and they don't hear about these issues. So I just wanted to finish.
No, it's a good point to end on. Thank you. Because as medical doctors, health practitioners, whatever your qualification is, you can do something simple on the side. You can write a letter to the editor of your local paper and write MD afterwards, or I am a healthcare, or this is what I've seen. And then your opinion carries a huge amount more weight. When you write in with your credentials, you write in as a citizen, I'm concerned about this, or this is what I've seen in my practice. It's one of the small things that you can do to add your voice to it. And I just wanted to wrap up today by, first of all, saying thank you all who stayed to the end. It's important to all of us. In your package, I've been told there is a declaration, if I'm right, that the doctor's declaration, that if you'd care to sign on to it, we are still, even though part of it has been submitted to Health Canada, there was a deadline in July, we're still gaining credibility of it by adding names and to it. And I have to thank all of our doctors, Havis, Miller, Davis, Taylor, Dr. Clegg at one point during the conversation, I think it was mistakenly, and Dr. Bray, of course. And regarding writing your politicians, if any of your patients come to you, send them to the C4ST website and say there's a little thing on there on a contact where you can sign up and you can write your own politician. Frank is handling this like a corporate executive would, looking at blazing new ground, which was his forte for his career, by getting riding reps in every single electric riding across Canada and moving this thing from the ground up. And what we did today here, although it's the end of today, it's the very beginning of what we hope this is going to become. And that one day we hope to be at one day soon, a much larger venue addressing many, many more medical doctors and making it pro forma that on that list, when somebody comes choking, that we ask them, is there something causing it in your house? And this is, I hope, what we take away today. And thank you very, very much. All of what we need to do is on c4st.org. That's the hub. And that should be how you contact us. And thank you very, very much. We all owe you a great debt of gratitude for coming today.